Hello, my name is Yvette, and I'm a student at Delta College Psych Tech program. And in this video, I will be discussing somatoform disorders and how it affects the patient and how it also affects the parents of those who are suffering from this disorder. First, let's define somatoform disorder. Somatoform disorder is a mental illness that involves a person having and or experiencing great psychological stress that causes them physical pain, neurological pain, shortness of breath, and even in some severe cases, headaches and fainting spells. Next, let's identify the steps and characteristics in the process of critical thinking. Step one is the knowledge. For every problem, there is a solution. Now, this solution may take time through trial and errors, but there is a solution to every problem. First, we need to identify the arguments of the problem that need to be solved. Questions should be asked to acquire a deeper understanding as of this problem. The question should be an open-ended question, and it allows us to further discuss and find a cure or for distraction, such as what is the problem and how can we solve it. Next is comprehension. Once the problem is identified, the next step is to understand the situation and the facts that align with it. Data is collected in a scientific research method. Step three is the application. This understanding of different facts and resources are required to solve the problems by building a gap or building a bridge between the information and the resources. Mind maps can also be used to analyze the situation, and this helps build a relationship between the core problem and the stressor that determines the best way to move forward. Step four is to analyze. Once the information is collected and the bridges are built between the stressors and the main problem, the situation is analyzed in an order that identifies the situation and the strong points, the weak points, and the challenging points that are faced while solving this problem. The priorities are set for the main cause and determine how these can be addressed. The problems are divided into the causes and they're also based on different categories from the highest priority to the least priority and how much of an impact that will have on the problem. There are a number of tests that can be used when identifying this. There are tests that will help determine a person's or individual's mood, presence of depression, other emotional states and psychological states such as presence of anxiety or psychosis, and to measure a person's adaptive ability. A full physical exam performed by a physician can help ascertain the physical issues that may be contributing to these symptoms. There's a neurological evaluation that is useful in determining specific types of neurological disorders that may be presenting in a psychological issue. Neurological evaluations typically include such techniques as neuroimaging and psychosociological assessment. Neuroimaging techniques. These are techniques that look at the structure of the brain and the functioning of the brain, and this can be useful. There are two basic types of categories of neuroimaging techniques. There's structural neuroimaging that focuses on the changes in the structure of the brain. And there's functional neuroimaging that focuses on the blood flow and the areas of activation in the brain during specific physical, cognitive, and emotional states. Neurologists and psychiatrists can choose the specific neuroimaging test they feel most appropriate for the particular case. Psychosociological assessment techniques can be useful, and these techniques include such procedures such as an EEG or electroencephalogram and evoke potential measures changes in the nervous system. For example, a seizure disorder oftentimes causes a person to have different neurological effects within the brain and individuals with psychotic disorders such as schizophrenia. Then there's laboratory tests that we rely on as well, such as blood and urine tests can help determine the presence of any medical condition, infection, or substance abuse or disorders that contribute to the individual's presentation. Next, we'll be applying reasoning and judgment in clinical setting for individuals with somatoform disorder. Somatoform disorders are a set of psychological conditions where a person experiences bodily functions that cannot be accounted for by a medical or neurological diagnosis. Symptoms can range in severity from mild and infrequent to chronic and severe and out of the individual's conscious control. Somatoform disorders are characterized by excessive focus on physical ailments such as pain and tiredness. Now, these physical symptoms cause individuals extreme mental distinguish um, or distress and significant impairment in everyday functioning. A person with somatoform disorder will constantly obsess every day over these symptoms while frantically searching for a plausible explanation for them. There's emotional well being that's often considered synonymous with happiness. There's social well being associated with connection, engagement, and relationship with others, with peers, family members, and friends. There's physical well being associated with health, the level of physical activity, and overall wellness. Self determination is also evidenced by the degree of emotional and control and choices. Social inclusion, as indicated by community immersion and engagement programs. Personal development focuses on skills development and the attainment of independence. Personal rights, including the preservation of dignity. Speech therapists, physical therapists, and occupational therapists help to determine functioning issues. Social workers, case managers, and vocational rehabilitation specialists are also included for a lifestyle of practical issue. Other specialists are involved in this, such as audiologists and other medical specialists. Religious and spiritual influence also help in this. And the reason why these are all important is because all of these different factors can help integrate into the patient or the client's well being and social acceptance. And there are many programs out there in the community that help assess with all of these. There's different agencies that once a parent is aware of the somatoform disorder that their child might be going through, that they can get in touch with, and the community resources are there to help guide them through. Now, as a parent, we want to make sure that our children are healthy and happy. And this means including on learning about the illness that they may be having. As a parent, I can tell you that if our children are sick, and we can have a medical diagnosis, this would better inform us that we can get help for them. But when it's a psychological problem that encompasses physical problems, those are a little bit harder to treat. And so we have to be mindful and we have to be our children's own best advocate. Identifying the components of formal assessment and mental health disability. Now, clinical assessment as the evaluations of a person's physical, medical, and cognitive, psychological, personality, emotions, and beliefs and attitudes, and behavior histories and current conditions in order to determine the presence of any mental health disorder. The assessment process is typically initiated by a referral, either from a physician or mental health worker or a licensed clinical social worker. Personality tests are formal psychological tests that measures aspects of an individual's personality or measures specific personality variables. In general, these tests can be divided into two major categories. The first category is projective personality tests, and these tests are provided to some point of ambiguous stimulus or task that the individual is required to give a subjective opinion of the stimulus to comply with the task, such as drawing tasks. The most well known of these tasks or tests is the Rorschach or ink blot test. The second part is called an objective personality test, and these tests have a specific type of question and answer format that may consist of choosing an appropriate answer from several choices that relates to the individual's self-perception, rating perception, feeling on a scale, or some other concrete response. There's the intelligence test that's used to rate the individual's level of overall intelligence compared to others in their peer group. Intelligence tests are important in determining various cognitive strengths and weaknesses in the individuals that may be associated with certain types of mental health disorders. There are a number of different formal intelligence tests that are utilized in tests such as the Wechsler Intelligence Scales. We have neuropsychological tests that specialize tests and administered by psychologists trained in brain behavior activity. These tests can be used to determine the presence of cognitive strength and weaknesses that may lead to be the result of a brain damage, a psychological disorder, or a neurological disorder, or a developmental disorder. Generally covers these issues such as intelligence, language, and ability to express oneself. Step 5. Synthesis. In this stage, once the problem is fully analyzed and the related information is considered, a decision should be formed on how to solve the problem, and the initial routes of the follow take the decision into action. If there are a number of solutions, they should be all evaluated and prioritized in order to find the most advantageous solution using the patient's strength, weakness, and opportunities for a good recovery. Step 6 is to take action. The final step is to build an evaluation about the problem that can be put into action. The result of critical thinking should be transferred into action steps. If the decision involves a specific project or a team, or a plan of action should be implemented to ensure the solution is adopted and executed and well planned, and all that is concerned and considered in this process should be well aware of the plan and be able to execute it. Then we have characteristics and processes. Characteristics should include open-minded, curiosity, or willingness to want to learn more, good judgment, and effective communication skills. The critical thinking method process can be adapted to replace emotion or any biases when trying to think of a situation or a problem. The time for adapting critical thinking varies based on the problem. It may take a few minutes, it may take a few days, it may take a few hours, it may even take a few tries. The advantage of deploying critical thinking is that it contributes to a widening of our perspectives about the situation and broadening the thinking and the possibilities. However, these steps should be translated into a plan of action to ensure the best resolution is achieved. Identifying the steps for a blended quality of life and concept into our own assessment intervention is to ask questions. My resources for this video today are from Townsend, Morgan, 2019 Psychiatric Mental Health Nursing, The Concept Cares in Evidence-Based Practice, and A Day in the Life in the Community-Based Behavioral Health Care Management. Thank you for your time. Thank you.